Good afternoon, everyone. This is Andy Reese, the Director of the DC Department on Disability Services. As always, I'll first share our current data regarding COVID for DDA. We are now at 437 people who have tested positive for COVID, which includes 2 people who had previously also tested positive. One of them in August who had previously tested positive in May of 2020. In September, we've had 3 people test positive already. 2 of those people were vaccinated and 1 not vaccinated. In August, there were 6 people total who tested positive. 4 had been vaccinated and 2 not vaccinated. The unvaccinated people in August were in a supported living placement, and the 1 person in September was in their natural home. And so placement site, I hear some noise. Is there an issue? Site.
Someone has said, let me begin.
I hear some noise. Is there an issue?
Director Reese, I'm trying to identify it, but everyone's muted, so I'm not quite sure what's taking place. Okay, I think you're good to go, Director Reese.
Okay. Can you just confirm you can hear me? Because
Yes, I can hear you.
Okay, I'm not seeing. Okay, there we go. Okay, so by placement type, we have had 9 people in host homes, 114 in intermediate care facilities, 1 in a mental health facility, 57 in natural homes, 2 in a nursing home, 4 in out-of-state placements, 39 in residential habilitation, and 211 in supported living. And so, so by placement type, the 114 people in ICFs represent about 38% of people in ICFs who have contracted COVID. Of the people in ICFs who've contracted COVID, we've had 28 people die. However, 13 of those have been confirmed as COVID deaths, and that represents 11.4% of people who contracted COVID who have had a confirmed COVID death in an ICF. In natural homes, the 57 people who've contracted COVID represent about 6% of people in natural homes. 5 of those people have died, and they've all been confirmed as COVID deaths. That represents close to 9% of people in natural homes who contracted COVID who died from COVID. In residential habilitation, the 39 people who have contracted COVID represent about 35% of people in residential habilitation. Of those, 3 have died, but only 2 were confirmed COVID deaths, representing about 5% of people in residential habilitation who contracted COVID, who then died from COVID. Supported living, the 211 people who contracted COVID represent about 23% of people in supported living. Of those, we've had 22 deaths, but it's 15 confirmed COVID deaths that represent about 7% of people in supported living who had a confirmed COVID death. Sorry, it's 7% of people in supported living who contracted COVID, who then had a confirmed COVID death. And then overall, the 437 people who have contracted COVID represent about 18% of people supported by DDA who have contracted COVID. And overall of the people in DDA who've contracted COVID who had a confirmed COVID death, there are 37. That represents about 8.5% of people with COVID who have a confirmed COVID death. Total, as people may recall, we've had 61 deaths, and I'll go over those in just a couple more slides. So as I said, in September, we have had 3 people who've contracted COVID, and in August, there were 6. 2 of the people in August were in a residential habilitation placement. Sorry, 2 were in a residential habilitation placement. 4 in August were in supported living, and 2 in September were in supported living. And in September, 1 was in a natural home. We have not had anyone require hospitalization for COVID treatment since April. So as I indicated, 61 people have died. The most recent in August. However, of the 61, 16 have been confirmed as not COVID related. And for 8, we are still awaiting the results from the medical examiner regarding the cause of death. And so we have not had a confirmed COVID death since March. And as you see, there have been 37 confirmed COVID deaths. We don't have an update this week, I'm sorry, on the provider staff diagnosed with COVID. This update is from last week. There were 715. There have been some more, and I'm sorry, I'm not providing an update today on those numbers, but there were 715, 10 staff deaths. Of the 715, 52 of those staff were reported by at least 2 separate agencies. And just as an update regarding vaccination rates, overall, people supported by DDA, we've updated this as of yesterday. 77% of people supported by DDA have at least begun their vaccinations for COVID. That includes 78% of people in host homes, 98% in ICFs, 61% in natural homes, 96% in residential habilitation, and 85% in supported living. Amongst provider staff, this should be updated on our website, I believe, and this data is updated as of yesterday. We're at 67% of provider staff. I'll be talking in a minute about some recent information regarding vaccinations for provider staff. And then DDS staff, people may be aware that the district government has a mandate that all staff be vaccinated or meet one of 3 exemptions by September 16th. And as of September 1st at DDS, 84% of our staff have been fully vaccinated for COVID-19. So I just want to provide some brief updates, and we have some visitors today from DC Health who may be able to answer questions that people have regarding this. Last Friday, DC Health issued new regulations that clarify and establish a requirement that all staff who have direct contact with people supported by, it doesn't explicitly say in the regulation, people supported by DDS, but so it includes, what it does essentially is that it includes a requirement for vaccination as a qualification required for people who provide Medicaid supports to people in our waiver placements, and also for people in intermediate care facilities. So anyone working in any Medicaid funded placement, in order to meet the qualifications for either the waiver or for the ICF, all of their staff who have direct contact with the people supported there will have to have begun their vaccination by September 30th. And so this includes, we have some Medicaid providers who provide services in other states, quite a high number of folks who provide services in Maryland, but also some waiver providers in other states. And the requirement in terms of the qualifications for their staff, in terms of our waiver requirements to provide that Medicaid service, includes a requirement that that staff be fully vaccinated against COVID-19. And as I said, we do have some folks here from DC Health if people have questions about that. And I'll just repeat, this mandate also actually first was implemented regarding district government employees, and that goes into effect at the middle of September. By September 16th, all of our staff will have to be vaccinated, and we are, or meet one of 3 exemptions, and we are following up on that, and we'll continue to post those numbers as well. We did not receive any questions in advance. I do recognize that this is a holiday weekend, so it's amazing. Summer is over already. So our numbers may remain low today. It's jumped quite a bit since we started. But if people have questions, please make sure that you scroll down to everyone in the chat and you can type your question into the chat. While we wait for that, I know that there were some updates to guidance that have been published by DC Health, and maybe if Nelson Vanucci from DC Health, I'm pretty sure is with us, if he could just identify for people what the updated guidance is so that you can identify that and review it yourselves to make sure that you're aware of what those requirements are, and then perhaps come back with specific questions later, like in a subsequent week.
Thank you, Director Reese. So there are some updated guidances that have posted to the coronavirus.dc.gov/healthcare website. Among them is updated guidance for ICF facilities. The updates are pretty minor, but bring the guidance in line with the mayor's indoor mask mandate. So please review that. Other guidances that have updated are the return to work for healthcare settings, and also for those that guidance does not apply to, the fully vaccinated guidance for the community has also updated. Place specific attention to the requirements or recommendations for those that are fully vaccinated after exposure, as there's some testing requirement now that is recommended. So please review that, and you're welcome to come back with questions today if you have them, or I'll also be present next week to answer any questions you might have. Thank you.
So we have a question. What is the plan for booster doses of COVID-19 vaccine for people we support? If I'm not mistaken, and there's a number of people from DC Health who could clarify, there is still no recommendation officially for a booster. The other thing I will say, and then I'll step back and let DC Health speak to whether there's actually a recommendation for when such boosters would start, if that's out there yet. The reason that we worked, and I think worked very well, with DC Health last January and February to coordinate vaccine clinics was issues related to the availability of vaccine. Those issues do not exist. We have providers now who are responsible for ensuring that folks get their health care. And if there's a recommendation for people to get a booster vaccine, I would expect that the provider can help folks get that vaccine in the community. You can go to the coronavirus.dc.gov website and find places 7 days a week where vaccine is available. But if someone from DC Health could comment on this recommendation for a booster.
Director Reese, this is
Andy,
Nelson.
Shirley Wills.
Oh.
Go ahead, Shirley.
Okay, thank you. I don't think we have a specific answer at this time about boosters, but I wanted to get the correct question, and we will follow up with an appropriate answer.
Thank you. Yeah, I didn't think it's recommended yet, right? We hear a lot of it should be happening, but not a specific recommendation at this time.
Okay, so you just want clarification that we are not recommending, that DC Health has not proposed recommendations for booster shots.
And once it's recommended by CDC, DC Health will then make a recommendation, right?
That is correct.
Typically,
Yes, this is
Okay.
Dr. Lewis as well. And yes, Ms. Wills is correct. At this particular time, we have not had direction to say that we're moving forward at this time with the boosters. So we will go back and do our research on that. But we do follow, of course, the CDC requirements. And I think that we really are waiting for FDA to fully opine on what that directive would be as it pertains to the booster.
Thank you. And I think that you just answered one of the other questions, which is, will the vaccine mandate also include boosters that come out next month? And what will fully vaccinated mean in the next few months? And there is someone here actually from DC Health who can speak to the regulation, but the definition at this time of fully vaccinated is that you've gotten 2 shots of one of either Pfizer or Moderna plus 2 weeks, or that you've gotten 1 Johnson & Johnson and 2 weeks.
That
If
is
that
correct.
definition changes, then the definition will change. But at this time, that's the definition.
That is correct, Director Reese. That is correct.
Thank you. Are agencies giving their staff paid time off for the vaccine or taking off if they are experiencing side effects? That would be up to each individual agency. I know the district government is giving people 2 hours off to get the vaccine, and once people are fully vaccinated, gives people 8 hours off. And I see from one person, from Amy at RCM, that agencies are giving people time off for the vaccination and side effects that RCM is. I will also say the vaccine is very available. As I said, 7 days a week. You can really look up a site to go get a vaccination, and there really shouldn't be issues of people saying that it's only offered during my work hours.
Director Reese, this is Daryl Hawkins from DC Health. I want to also remind providers that there's other applicable regulations, for example, for OSHA. If the OSHA ETS standard applies to you, that ETS standard 1910.502 does say the employer must support COVID-19 vaccination for each employee by providing reasonable time and paid leave to each employee for vaccination and any side effects experiencing following vaccination. So again, I would, not from OSHA, but please, if you're a provider, see if that OSHA reg applies to you, and please read that section carefully and apply it as appropriate. Thanks.
Thank you. Oh, can you give that citation for the OSHA reg again? And
We'll drop
Okay.
it in the chat.
Wonderful. Thank you. I don't know if I may not have mentioned specifically. I thanked them when we were in our session before this began, but we do have a few folks who have joined us from DC Health today, additional folks who've joined us. In the event, questions came up about the regulation that was issued a week ago. And so to the extent you have those questions, I would invite you to ask them now while they're here with us, since they very last minute, when we reached out to them, did make the time to come today. So if you do have questions about the regulation or its implementation, they are here to be able to respond to those. And I do see there is a question. Will DC Health be creating an exemption form for the providers to use for people who claim the health or religious exemption regarding the vaccine?
This is Dr. Lewis again. At this particular time, we are not creating an exemption form. However, when we actually roll out to the licensees and unlicensed individuals a portal, they will be able to submit their written exemption request that would require DC Health to approve. And that would be for medical, religious, or if they obtain the vaccine out of the country. We would then ask them to submit something in writing to us, and that would be the exemption request.
So someone had a question, which order and date are we following regarding having all DSPs fully vaccinated? The mayor's order for 9/19 or the DC Health guideline for 9/30. Also, the DC Health order did not mention if DSPs still have the option of weekly testing. So the DC Health was a regulation that was issued as an emergency, so effective on the date that it was signed. And that requires that DSPs at least have gotten their first shot before 9/30. The mayor's order regarding 9/19, applies to the DC government. And it also applies to certain contractors with the DC government. But in terms of DSPs, what controls is the regulation from DC Health regarding vaccination of all licensed and unlicensed healthcare providers. And you correctly noticed that the option of weekly testing is not in that regulation. And for those folks who had watched the mayor's press conference where the mayor and Dr. Nesbitt spoke about this, they had indicated that the option for weekly testing would go away as soon as a vaccine was fully authorized. And in fact, the Pfizer vaccine has been fully authorized by, or fully approved, I don't know the correct term, by the FDA. And therefore, there is no option for weekly testing in the regulation that applies to DSPs. There's a question, can someone from DC Health drop in the chat where to get home COVID testing kits? And are those PCR tests? And I don't know if you mean like person by person, because I know that an individual at a number of different DC libraries can get a home testing kit, or if you're talking about the agreement that some agencies had with DC Health where there were testing kits provided to those agencies.
Director Reese, for that question, I will say we had some provider pilot. I don't think it's no longer going, but those home testing, those kits for the testing for the pilot was PCR based. I did just go on our coronavirus.dc.gov website. I will drop that in the chat. The individual home testing kits, I'll send that link. And those kits for this website information are PCR tests as well. So I'll put that in the chat now. Or I think Nelson might have just done it. Thank you. Yep.
There it is. This says the current guidance on work restrictions for staff with known exposures states that unless fully vaccinated, exclude from work for 14 days after the last exposure. What is the work restriction guidance or requirement for fully vaccinated staff who have a known exposure for COVID-19? Nelson.
So this is Nelson from DC Health. It's stated pretty clearly in the guidance, but this is where it gets a little bit tricky depending on which guidance applies to you and which to follow. So for the return to work guidance for those that are healthcare settings, the requirement for work restriction for fully vaccinated is that there is no work restriction. They can continue to work, but need to be tested immediately and then 5 to 7 days after exposure. For those settings that are not considered healthcare settings, they would be covered under the fully vaccinated guidance that was updated for the community, which states that fully vaccinated do not need to quarantine after exposure, but should be tested 3 to 5 days after exposure. So it's a little bit different. There's a little bit of a nuance there, but that's the current recommendation.
And just as a reminder for our providers, those recommendations are going to be sort of broad recommendations based on the placement type. But as you serve individuals, you really need to make individualized, you need to look at those recommendations, understand them, and make individualized decisions. Because you could have people who are in a situation where they're working with someone who is medically very complex, very who is at a much higher risk, and you would want to impose the higher restriction, even though it may not be required by the regulation. So please make sure that you read and understand what that guidance says, understand what it's about, and make sure that you're making individualized decision for each person you support. This says the portal for the exemption is only for licensed people. What about exemption forms for the rest of the DSPs? So for unlicensed people, how will they be submitting their documentation for approval for an exemption?
Yes, this is Dr. Lewis. The portal will be made available to both professionally licensed individuals and the unlicensed individuals.
Can someone shed some light with regards to granting permanent or temporary exemptions? We do have someone here from DC Health who knows the regulation well. I thought it said that they were for a year, that there's no such thing as a permanent exemption. But please, someone who knows that regulation, perhaps by having worked on actually developing it, if you could speak to it.
Andy, you are correct. It is not, there is no permanent exemption in the regulations, nor was one contemplated. If you look, that is consistent with all other exemptions provided from EEOC down through DCHR. So consistency is there are no permanent exemptions.
Thank you. Now there's a whole list of questions regarding exemption requests. So is a person who has submitted an exemption request still allowed to work while that request is pending? When will the portal be posted, since there's only 4 weeks left until 9/30? Who will get the approvals on the regarding the exemption? And how will this be coordinated among the non-licensed staff?
Andy, I think these are the type of questions that are better handled in writing in response to provide guidance and give a better interpretation of it. So I would like to have the indulge upon you, if you will, to provide more of a written response to these questions about exemptions, because they tend to be a bit more nuanced than just saying yes, no, this is what happened, because they're very fact specific. We are taking our direction from how the rest of the district is ensuring that these exemptions are done consistently and executed consistently. It's more than just saying, when you put in the application, is it, can I still continue to work in that arena? It's almost saying that it's approved until denied if you answer incorrectly. So I do ask that we have a little bit of indulgence and to have more of an opportunity to gather these questions to make sure that we're providing as thorough guidance as we can on this matter. Would that be okay with you?
That sounds great. So in terms of the written questions, are you asking that they be submitted in response to the emergency and proposed regulation, or should it be directed to someone specific at DC Health?
Actually, what I'm saying is these questions that are coming up in the chat, I'm going to copy and paste it and put it in a document and respond to them.
Perfect.
As they are
great.
provided
Okay.
here. Nothing very formal, just the questions that are presented here in this chat room. I would have a response for it that is a little bit more than just yes or no.
That sounds great. Thank you. Would weekly testing still be used for those approved for either medical or religious exemption as a way to confirm that they are COVID-free and can work? My reading of the regulation was that it was not required by the regulation, but that didn't mean that it couldn't be required by the individual agency. But we can add that as a question. But that is specifically addressed in the regulation. There is a comment here. Amy, test kits are available at libraries. Yes, and that list of libraries is in the link that was provided in the chat. Is it now clear on the website that the home tests are PCR? A few weeks ago, that information was unavailable. I thought Daryl was reading it from the website.
Yes, Director Reese. That was Mrs. Nelson.
I saw your written response. Sorry. Yes,
That's okay.
It is in the frequently asked questions that it's PCR. So there are some other questions here. What is Test Yourself DC? That among the frequently asked questions, Test Yourself DC is an at-home COVID-19 testing kit. The kit is a PCR test. Is there any criteria or website we can go to ensure we're not receiving fake vaccination cards?
Not quite sure where this question is coming from. Most places when you register to receive your vaccination, you can look that you will receive a PIN number and a password to look up your registration and information. So even if you receive a card that has been signed off, you can double check it. Normally with most places that you've already registered when you made an appointment to get the vaccination. So the card is not necessarily your proof, but another form of information, but it's not the only form of proof that you have received the vaccination.
And now another question that'll be added to your questions, to which I think a written response could be provided. How will proof of sincerely held religious belief exemption be evaluated by DC Health?
And again, this is a fact-specific question. I actually went through some training for the exemptions, and DCHR is providing it across the city. It is a very fact-specific, in fact, intensive review. If it's not just based on your religious belief, but does your religion, the leader of your religion, is this a belief that they espouse? If this is a belief that your religion espouse, then it will also include, well, how closely do you follow your religion? Is this the only tenet of your religious belief that you have decided to follow? It does encompass that kind of review. So how will proof of sincerely held? It's if this is part of your religious belief and this is the leader of your religion says this is we believe the vaccination is against our tenets, and then there's some kind of proof to show you follow it, you attend weekly worship services, or you're a leader of the church, things of that nature. But again, I'm just throwing out hypotheticals. It's a fact specific, case by case basis. The exemptions are not a whole, just a one-stop shop. This is my religious belief, this is my religion, and that's it. It is taken with the sincerity that someone is submitting it and trying to give them deference to that.
And the challenge there, so I believe the training you're referring to, some of our staff went to, was DCHR arranged for training by EEOC. I think that's who coordinated it, right? And I think it's probably very important for individual agencies who are evaluating these exemptions to consult with their own counsel about the guidance around how do you confirm sincerely held religious belief. And that way, when you submit something, you will have some level of confidence, at the very least, that if DC Health questions it, that you'll be able to respond to those questions.
Andy, I think you're hitting it on the nail on the head. Do you want to respond to the rest of them for me? Just joking, but
Sorry.
I think no, I'm teasing. But that's exactly what it is that you have to be able to respond when someone has a question, and it has to be very factually intensive of a response to not just ensure that this is your sincere held religious belief, but it encompasses the vaccination exemption. And it's a process.
And this is probably added to that list of questions. How will providers be notified or made aware of a staff that has completed an exemption and the exemption has been approved or denied? And then who should additional written questions be sent to? Just type your written questions in, and as I read them, I think they'll be taking them down as well so that they can provide written responses.
Process questions, Andy, if you will. Those are the ones I'm definitely deferring about how are they going to inform an employee versus the employer or the provider that this employee's exemption has been approved. So that kind of process question, I'm going to defer to answer at a separate date in writing. I could provide, um, I will answer the other question about FDA approval for vaccines outside of the country.
Oh, okay.
Unless you want to take those away, you want to, we'll answer that one, provide guidance on that one.
I missed that one. I'm trying to scroll up to make sure that because a lot of questions were entered at the same time, so I may have missed some. So I want to make sure I'm not skipping over anyone's question. And Ian brought to my attention because of all of these questions, I forgot to mention in my opening that in fact, the district's ARPA plan was approved this week. And so included in our plan was a plan for reimbursement to providers for incentives for vaccination. And this was a district plan, not just a DDS waiver plan. And so we are working with the other district agencies to work out the details of that. And as soon as we have those details, we'll share them. We met with DHCF this week. And so we are having some subsequent meetings to plan for exactly what that reimbursement will look like. Is the vaccination requirement for day programs as well? The vaccination requirement applies to any Medicaid provider. So the day programs are paid through our waiver, and or in some instances, the day programs, it's a transfer of funds for active treatment for folks who are in an ICF. So that's also a Medicaid service. And so, yes, it applies to day programs as well. Is there a common religious exemption form? No, there is not. And I think you could tell even from the description of how that whole factual inquiry goes, having one form would be pretty challenging. Does the vaccination requirement apply to administration staff as well? It seems to apply to direct people who have direct contact with the people you support. So it would apply like to the driver of your van, not to someone who works back in the office who has no contact.
Actually, Andy,
Oh, am I wrong?
I will read to you.
Go ahead.
You doing great. So I'm just going to read directly from the regulation itself that says the term unlicensed person includes, but it's not limited to administrative staff. You know, at the end, administrative staff is included.
Oh, sorry. Thank you.
And that comes also from previous regulation in the Healthcare Facility Unlicensed Personnel Criminal Background Check Act of 1998. That term of unlicensed person always included administrative staff.
This is why we invited them. Thank you very much. So the section 230.8 allows providers not to provide an exemption if they choose. So this can apply for changing the deadline date or the religious exemption or the medical exemption, is this right? Very little of that sounds right to me. I'd have to look at, and maybe someone can speak to section 230.8, because the health exemption happens because the ADA, and the religious exemption happens because of the Constitution.
So that section, Andy, is just saying that the provider could be stricter than these regulations. So if we're saying the date certain is X, they can make it give a more narrower time. But changing, they cannot change the religious exemption or the medical exemption to be much more narrower than what we have stated. But what it says, and I quote, is an employer or contractor may impose COVID-19 vaccination requirements on its employees and contractors that are stricter than the requirements imposed by this section, such as requiring its employees and contractors to be vaccinated at a date earlier than required by this section, not providing an emergency use authorization exemption from COVID-19 vaccination requirement, and requiring that unvaccinated employees or contractors be tested regularly for COVID-19. So it's more so that they cannot be more broad, but they could be more stricter in what the regulation has allowed.
And this is also in response to someone's earlier question. This is the section that addresses weekly testing, which allows for providers to do it, but doesn't require it. So I just also want to clarify, our ARPA plan was partially approved. There are some sections of it where they've asked for some clarifying information. There were no sections that were denied, and the clarifying information seems that ultimately there will be no impact on the parts of the plan regarding DDS, but we do need to provide some clarification. For example, what the mechanism is that we have for paying for access to Wi-Fi, because that can't be paid for using Medicaid funds long-term. So there's a question about the reference to emergency use authorization and what that means.
If you, as you stated earlier, Andy, other than Pfizer, the other two vaccinations are still under EUA, meaning that at this time, there is, they haven't been approved. Let me get the jargon corrected as well, for full usage. So they're all still under emergency use authorization. There are certain exemptions under EUA that an employer could recognize. What we're saying, what's going in that section there is that they don't have to recognize EUA exemptions. But it's only applicable to Moderna and the Johnson & Johnson vaccination. The non-FDA approved vaccinations like AstraZeneca and I think what's the other one? There's another one, but I do see that question. I have to have an opportunity to provide actual guidance on that one. So I do see your question on that, and I have jotted that one down to respond to in writing.
Okay, well, it appears that we don't have any additional questions. Thanks for everyone who joined the call, and especially thanks to DC Health, especially you folks who, to all of you, because DC Health is always is a support to us every week. So the folks who join us weekly, thank you, of course, but especially also those folks who joined us a little last minute, and were able to respond to these questions regarding this new regulation for our provider staff. There's a question about when we might be able to expect written responses. Is it possible that we'll see them by next Friday's call? And so hopefully they should be available by then. Keeping in mind, Monday is a holiday for all of us. And generally, the benefit of a written question is that they can give a more detailed response. The downside is that there's going to need to be review of that written response. So we'll just make sure that we can get a complete and accurate response to folks, ideally by next week. And so, as I said, thanks to folks from DC Health. And as I have been saying, as our vaccine mandates have been evolving, the important thing is that we continue to do everything that we can to engage with, for example, the almost 40% of folks in natural homes who've not yet gotten vaccinated, our 37% of staff who are still not vaccinated, because the only way we're going to move past this and really, live safely once again, at least safe from coronavirus, is to see this vaccine really reach a much higher percentage of the people we support in our staff. And so if folks can continue to please continue working with your staff and with the folks that we support who still haven't gotten the vaccine, and hopefully together we will move beyond this. So thank you very much. Have a great holiday weekend, everybody.